Good afternoon. This is Laura Soares from the Vermont Education Health Initiative. And if you just watched the beginning of the board's meeting of October 20th, you will see that the recording ended about a half an hour into the meeting. So we were unable to provide the Vermont School Boards Association with the entire recorded meeting, which they had requested. But one of the areas that I have gotten several requests on is if I could retape the presentation I did on the FY22 health rates. So I will do that portion now so that it may be posted. This was a public meeting and it was only due to technical difficulties that the meeting in full is not available for viewing. So one of the most critical things that the VHI board does is to file the health rates. Each year, they do get approved by the Department of Financial Regulation. And we will be filing the FY22 health rates for the year that starts July 1st, 2021 and goes through June 30th, 2022 by the end of October. This presentation that I'm giving is as similar as I can recall giving to the VHI board. If you watch the part of the meeting that was recorded, you will have heard Chris Roberts give the financial statement as of June 30th. And whenever we set rates, we actually look at 4 fiscal years in order to inform our rate setting. We look at the year that ended a year ago, so FY19, because when we closed FY19 on June 30th of 2019, there were actually still several months of claims that had been incurred during that time period that we had not yet paid. And we save aside some money to do that. But in this case, FY19, as described by Chris, we spent over $7 million in claims that we had not anticipated. So those funds come from our reserves, which we hold for that purpose. But it means that our reserves were on the way to being reduced in 2020. FY 2020, which just closed on June 30th, 2020, actually ended up with a $2 million gain after taking into account that $7 million loss from FY19. And the fact that as of March 30th, 2020, we were on track to draw another $4 million or more from our reserves because our claims were running higher than expected. So what made the difference was the pandemic, COVID-19 of 2020, which, as we all know, basically brought services to a halt in late March through mid-June, when all non-urgent medical services were stopped and we were under a stay-at-home order. So that ended up dropping our total claims spend in FY20 from its trajectory and ending FY20 with a small gain of $2 million. So we need to look at all of that information as we start to rate for FY22. And we also need to look at FY21, the year we're in now that we started July 1st. And we need to say, again, given the pandemic and given everything else we know now, about what hospital budgets are and what pharmacy costs and our enrollment numbers and so on. What do we expect in FY21? How do we expect to end this year? And then where do we need to end FY22 as far as our reserves? How much money do we need to have there in order to be in a strong financial position and cover the unexpected? So I'm going to share my screen and show a document that helps us look at that. And so this is a document that helps us look at our net position. Our net position is in this line down here. Net position is another word for our reserves. It's the money that we hold at VHI so that we can pay claims that are higher than expected. We can weather any other unexpected costs that come our way since we set rates. And this number, this percent down here, is our what percent our reserves are compared to our total expenses for each year. Our target is 15%. So we have a policy that was set with an actuary and approved by DFR that says we want to hold in any given year in our reserves 15% of what we expect to spend that year. And the first line is our contributions, what we will, or what we did actually collect in premium from both the active employees and school districts and the Vermont State Teachers Retirement System, which is also a member. Our total expenses, and then here you can see our 2 million gain. So we ended with just under $36 million, which put us at 13.5% of expenses. It's under our target of 15%, but it is still within our policy acceptable level. It does mean, however, that we need to work towards that 15% target. So when we look at FY21, if we had not had a pandemic, we would actually be looking at the light blue column. We did set rates for FY21, you might remember, at 12.9%. We needed 10.9% in order to pay all of the estimated expenses, and we added an additional 2% with the idea of adding almost $5 million to our net position, and even then expected our percentage to drop to 12.1. So while we would hold flat pretty much the amount of money, because our expenses go up, this percentage would go down. And that rate load and that 12.9, as a point of clarity, only applied to active plans. That's what we're talking about now, not the Vermont State Retirement System, which has a different set of plans that the board will discuss later. So we would have expected FY21 to erode our percent, but hold our actual dollar amount level. However, the dark blue column is our current estimate of how we will end FY21 a year from now. And that is, instead of gaining about $5 million, actually losing about $5 million, which is about a $10 million swing. That would drop our reserves to just about $31 million, which then our expenses are going to increase, drops us to 10.4, which at 9%, we actually have to take formal action to rebuild. And so that is obviously a concerning number, and we can't sit at that place. Now, what's driving that $10 million swing of FY21? There's two factors. The smaller factor is the CSEHB acronym, which stands for the Commission of State Employee Health Benefits. So that commission is now responsible for setting out-of-pocket cost share as well as premium share for school employees. Their decision came out of arbitration, and the decision that the arbitrator awarded, we project will increase our premiums or will cost us about $2 million in FY21, because the HRA benefits overall are more generous than what we had expected when we set our rates. And that means that we expect not to see a reduced utilization of services because people have access to the HRAs and behave differently under those circumstances. So that's about $2 million swing. And we had anticipated that when we set the 2% load and thought that we would be able to absorb it and still increase our net position. But the real factor is the pandemic. You can see COVID 3% increase in claims. We do believe that many of the services that were delayed in the last quarter of FY20, when people were unable to get their knees replaced, for example, or see their doctor and have their regular appointments, though many of those services will take place in FY21. So we now expect our FY21 claims to increase 3%. So that sort of savings that we saw from the shutdown, some of that will take place this fiscal year instead. So as we go into the FY22 rate setting, we need to take that into account, and we actually need to rebuild our net position, our reserve level, and try to get back to at least this 13.5% target. So the recommendation from the management team, which includes Mark Hage from the Vermont NEA, Bobby Jo Sauls, my colleague at VisBit, who works on behalf of VHI, and John Steiner, who has just joined the VisBit team and will be replacing me as VisBit president in 2021. So the four of us, along with manager of finance, Chris Roberts, who presented the financial statements to the board, agreed that we need to the active rates, add additional percents to the rates so that we can collect an estimated $12.5 million. We expect $2.5 million of those dollars to actually not go towards our net position, but to be spent in some way. There's a lot of things that are happening in FY22 that are hard for us to predict. One of those, for example, is will there be any cost to VHI in the vaccines that we hope will be available next summer in large quantities for the COVID-19. So we may have to cover vaccines and their administration. We also know that Visitors, one of our members and our largest member, has a responsibility to go out to bid for health benefits every few years, and that they will actually be looking at what their options will be for FY22. So that's an unknown. And we don't really know what hospital budgets will be at that time and whether they'll go back to their average level of increase or whether the pandemic will cause them to stay elevated as they were in this last cycle. So the bottom line is we expect out of that 12.6 million that we need to raise from these rates above the expenses for the year. About 10 million will end up in our net position, and that will just basically hold steady. The dollar amount is more, but the percent of expenses which are going up hold steady. So that was the first part of the rate setting process. The next is to look at what do the actuaries at Blue Cross think that we will need for a rate increase in order to cover this $308, almost $309 million of expenses. That's claims, that is our predominantly claims. It's also administration costs, stop loss costs, assessments, all of the pieces, our wellness program that get baked in. So what the actuaries did was indicate that we would need a 7.7% increase. That's from a break-even rate in FY21 to a break-even rate in FY22. Now remember, in FY21, we didn't set the rates to break even. We added a 2% load on those rates, even though we don't think that's enough to keep us at where we hope to be. And we aren't going to set the FY22 rates at break even because we need to add again to our reserves. But what is that break even point? And it's 7.7%. And what makes up the 7.7%? And this middle column is the step column that we look at. This is cumulative. So as you scan this, the 1.7 number right here, that increase, the first two numbers are slightly adjusting our current membership and plan enrollment, and to take a look at that. But the 1.7 is we need to relook at FY21. When we set FY21 rates a year ago, we didn't have as much information as we do now about what the prices are and how much hospital budgets are going up, pharmacy costs are going up, cost of MRIs are going up. So that's a 1.1% increase just looking at FY21 again as a starting point. And then we have to take that starting point, which is up slightly, and look at what do we expect another year later in FY22. And we expect a 5.6% increase on top of that in the cost of medical and pharmacy services. The vast majority of that is being driven by the fact that hospital budgets, which were just approved by the Green Mountain Care Board for FY21, will go up higher than typical. That's again because of the pandemic and the need to keep our hospitals solvent and functioning. That was a decision made by the Green Mountain Care Board. Then we have a 1.2% for benefit leveraging. Benefit leveraging is acknowledging that our copays, our deductibles, and our coinsurance have not changed since these plans were introduced in 2018. And when you have those items stay the same over time, just because of the time that passes, the amount of those copays, deductibles, and coinsurance cover a little bit less each year of the total claim. So for example, if we had a $5 copay for an office visit, and we don't have a $5 copay, but if we did have a $5 copay for an office visit, in 2018, that would cover more of the total cost of the visit than it will in 2022. So we have to just acknowledge that fact and adjust for it. Again, we don't change copays, deductibles, and coinsurance every year. It's something you do periodically, but you have to price your premium to acknowledge that. The next 1.2%, this induced utilization, that is actually, again, due to the richer HRA benefits that were negotiated at the state level and eventually awarded by arbitrator. That benefit started in FY21. It will be in place in FY22. And because those benefits are a little bit richer than current across the state on average, we need to price for that. So that raises our rates about 1.2%. And then we actually have favorable news. This is a one-year benefit. Blue Cross has a new pharmacy contract that will be in effect next July 1st, 2021, and that will actually lower quite substantially the prices that we will have to pay for pharmacy. So that's a 2.1% decrease that will bring us down to a lower number. We'll have to build from that in future years. And then 0.6% is everything else. Administration for VHI, for Blue Cross, assessments that we're required to pay to the state, stop loss insurance that we carry, and so forth. So that comes to a 7.7 indicated rate increase. Now keep in mind, that would be to break even, and we need to actually add money to our program. But before we look at our recommendation, that 7.7% does not apply to all plans evenly. So if you were to apply the 7.7 to our platinum plan up here, the platinum plan needs a 6.2% increase. The gold plan needs a 7.8. The gold CDHP plan needs a 7.5. And the silver CDHP plan actually needs a 16.4% increase. Overall, it would be a 7.7. What the VHI management team recommends is actually a 9.8% increase. That would be 8.3% for the platinum plan, 9.9% for the gold plan, 9.6% for the gold CDHP, and 18.5% for the silver CDHP. This adds 2.1% over the 7.7, and that will raise from the actives about $12.5 million. Again, we expect about $2.5 million to be spent for some unknown factors that are still in play, but we do expect to be able to rebuild our reserves and stay at our responsible level here of 13.4% of expenses, still knowing that we need to rebuild over time to our target of 15%. We certainly don't want to lose ground. The board did approve this in their motion, and the motions can be read in the minutes, which are posted at the VSBIT website, the VHI website. But there was a second motion that we requested and was also approved. Again, these motions can be found in the minutes of vhi.org. And that was back to our expectations about COVID claims increasing about 3% in FY21. That's based on analysis that Blue Cross did in July. They are in the process of updating that analysis in the next several weeks and expect an updated analysis for us to review in mid-November. If that analysis is significantly more favorable, if the information Blue Cross has to look at thinks, for example, that claims won't be increased by 3%, but will maybe increase only by 2%, for example, we asked the board for discretion that if the entire management team agreed, we could amend our rate filing with DFR, which we will make on October 30th, to decrease the rates by up to 1%. So we were granted that authority. Again, we won't even have the data to look at until mid-November. Now, the board did ask, what if it shows that indeed we expect claims to be higher, 4%, for example? And our response was we would not ask for an additional load above the load that we've asked for. We would stay with the 9.8. We do realize that the net position would erode somewhat and maybe end in the 12% range, but that we thought that that was enough pressure for us to put on those rates in 1 year. So we have the potential to decrease, but no potential to increase what we filed. Now, keep in mind that DFR makes the final decision, and if they feel that we need to do more in 1 year to rebuild our reserves, then they will have a conversation with us about it. However, we are confident that we are presenting a responsible rate filing with a strong rationale. So that is a summary of the presentation that was made to the VHI board. You can look at the minutes of the board meeting to understand the other items that were discussed. And again, I apologize that we had technical difficulties that made me have to redo this so that you could have the advantage of having information. Thank you.